Harmful algal blooms are on the rise. They occur throughout the world. Harmful algal blooms are what's called cyanobacteria.
These harmful algal blooms can release toxins that can be very harmful to both humans and animals.
When we had a do not drink advisory because of the contamination of our city's water supply, this was really a wake-up call, I think, for us because it impacted the community.
Now, these toxins can cause a huge amount of mischief. They can irritate the skin.
Elevated liver enzymes.
If you ingest them, they can actually destroy your liver.
Some of the common clinical symptoms associated with harmful algal bloom exposure would be indigestion or nausea. People have reported headaches,
Itching, rashes.
individuals experiencing trouble breathing from breathing in aerosolized toxins.
So we don't know the long-term effects of these harmful algal blooms on people that live in our area.
A lot of the patients who are coming in through emergency rooms are often being seen for respiratory illness.
Normal underlying diseases, they smoke, they have high blood pressure.
In addition to the harmful algal bloom exposure.
What happens when they're exposed to these harmful algal blooms?
In some regions, we know that harmful algal blooms can persist the entire year long.
People that are chronically exposed, for example, people that live and work and recreate on the lake constantly.
Does it make these conditions worse? Does it have no effect?
So it's important as a healthcare provider or a community member to understand that the risks are not just limited to the summer months.
Exposure to microsystems
They occur throughout the world.
can affect essentially every organ in the body.
Currently, there are no available treatments for symptoms of harmful algal bloom exposure. It's basically supportive care. This is why prevention is key in dealing with exposure to harmful algal blooms.
When in doubt, stay out. When you come across a body of water that looks unhealthy, don't go in it.
Unfortunately, people tend to ignore warning signs posted near the water.
Don't drink this water, and don't try to boil it. That actually concentrates the toxins. You need to steer clear of it.
A lot of the symptoms related to harmful algal bloom toxin exposure can mimic several different disease states.
Diagnosing these exposures-related diseases takes a while. It's not in our radar or in our mindset to look for these toxins. Actually, the first case took about a month because she really never fit any of the clinical criteria and was not getting better. This child also had other medical problems, was an asthmatic. Children with asthma or people with asthma who are exposed to these toxins can have a higher incidence of respiratory issues. The patient got treated just like anybody else, symptomatically, and how we would manage any serious problems in the setting. You have to exclude all of the known causes like viruses and bacteria. It was a high index of suspicion in the context of the environment and her exposures. We don't know whether it's due to the harmful algal blooms, but that was the context of her clinical picture. But you can suspect, you can have a high index of suspicion, especially when in the summer months, when they have higher incidence of algal blooms.
Harmful algal blooms are becoming more and more common, not just in the U.S., but all over the globe.
It's really, really, really important to follow the posted signs.
Patient recovered, had a good outcome for the long term, but took a while.
Agencies like the Environmental Protection Agency and health departments do have the capabilities to test the waters to understand if there is a harmful algal bloom. Universities like ours at the University of Toledo are happy to serve as a resource.
If you have a suspicion that you feel you've been exposed to harmful algal blooms toxins, it's really important to report these symptoms to your healthcare provider.